Having undergone specialist training in Moorfields Eye Hospital in United Kingdom, I had returned to my hometown of Ipoh in 1974 with the aim of providing affordable, quality eye care services to my patients. LEC Eye Clinic was founded at that time, and from being a solo eye care practitioner in this clinic, LEC Eye Centre was subsequently born in 1999 with the inclusion of 2 other consultant eye surgeons. Since then, we have grown to become a Ministry of Health recognized day surgical centre, and to date, LEC Eye Centre is the largest private group practice in Perak with 4 consultant eye surgeons.
LEC Eye Centre is a one-stop comprehensive eye specialist centre, and we're able to cater to all the eye care needs of our patients. We pride ourselves in having the most advanced technology to provide the best outcomes for all our patients. We have premium cataract surgical services, and this involves the acquisition of the first Lenstar optical biometer in Perak, which is actually a laser machine used to measure the eye before cataract surgery. We also have another advanced machine called the Varion Image Guided System, which is actually a precision machine that provides digital marking during cataract surgery. Now, aside from this, we also provide retinal services, and this includes the management of retinal detachment, age-related macular degeneration, and diabetic eye disease. We acquired the first in Malaysia sweat source OCT angiogram, and this actually allows us to take high-definition images of the retina and better manage these diseases. We also want to make sure that we are always accessible to all our patients, and they can make appointments to see us with a click of a button via our online appointment system.
At LEC Eye Centre, we have our in-house optometrists who are vision care experts responsible for accurate testing of spectacle power as well as contact lens fitting. They also provide vital support to our LASIK services. At LEC Eye Centre, we acquired the first in Asia wave-like refractive suite in 2011. One of the fastest lasers in the market, this unique all-in-one suite connects the machines used to measure the eyes before surgery with the laser machines, so all treatment information is sent wirelessly and allows surgery to proceed seamlessly and with unparalleled precision.
At LEC Eye Centre, we recognize the increasing problems of nearsightedness or myopia amongst children nowadays, and we have in place a myopia control program to combat this. This program involves the use of Myopin and eye drop, which has been found to be effective in slowing down the progression of myopia in children. So this program aims to increase awareness about myopia and allows our team of doctors, optometrists and nurses to work closely with parents to manage this epidemic which is sweeping the world. A key component of this program is the use of appropriately prescribed eyeglasses, for which our subsidiary company, Eye Care Optical, will be able to provide. Aside from children eyewear, a wide range of adult eyewear is also available.
Hello. Good evening, everyone. Thank you for joining us our live session. I'm Anna Lam, your host for tonight's webinar. Hi to everyone. Those who are actually joining us in our Zoom session. We also have live session in our Facebook and our YouTube. So let me say hi to everyone. Hi, Diana. Diana, can you let us know where you're from? We have Diana, we have Michael. Hi, Michael. Hi, Nurian. Hi, Sharona. Hello. Hi, Swana. Hi, we have also have Dr. Umi in the house. Hi, Dr. YC. Hello, Lisa. Welcome, everyone. For those in our Facebook, please put in the chat box, say hi to us, and then tell me where you're from. Okay, since we're going to have live in our Facebook, every month we actually will have this webinar to educate the public about eye healthcare. So remember to click those in our Facebook and YouTube. Please remember to like our Facebook to keep yourself updated, as well as to subscribe our YouTube channel. Okay, so every month we will have this session, so you will be posted on when will be our next session. So if you want to have an up close and personal session with our doctor, so you have to pre-register earlier to join us, okay, at our Zoom session, so that you can have a direct Q&A session with our doctors. So it's just like a open clinic, free consultation in a way. Okay, so without much further ado, I would like to introduce our speaker tonight. Okay, let me share this one. Okay, so Dr. Lee is our medical director for LEC Eye Centre. He actually graduated from University Manchester in UK. And he also have his ophthalmic training with Singapore National Eye Centre, as well as retina. Had his retina fellowship with the Lions Eye Institute in Western Australia. So he's also a visiting consultant for Perak Community Specialist Hospital, as well as KPJ Specialist Hospital. Dr. Lee is also a vitreoretina surgeon with a subspecialty on vitreoretina. So without taking much time, I would pass the stage to Dr. Lee to share his sharing tonight regarding the pandemic short-sightedness or myopia in children. If you have children who having this power increase during MCO, maybe it could be too much of gadgets, mobile gaming and things like that. So Dr. Lee, welcome. Let's everyone put your hand and welcome everyone, please.
You got a virtual hand. Thank you very much. Okay, thank you, Anna. And again, I echo the thoughts of Anna and all our colleagues at LEC. Welcome to all our guests to Zoom, and those of you on Facebook and YouTube, thank you for joining us. This is an initiative that we have started during the MCO period, because I think all of us as human beings would always want to keep connected to everybody else. And during this period, we had difficulties connecting with everyone. And this is one way we can reach out to you. I think those of you who are familiar or not familiar, we will let you know a bit more. We are doing regular public forums even before MCO, and this was more in a physical sense. We have a program where we move around Ipoh and Perak to actually do public forums. Why? Because we find that in our practice, there's still a lot of lack of education about eye care diseases. And what happens is when there is insufficient knowledge about diseases. People come late and they end up with poor outcomes and loss of vision. So part of the holistic approach that we take at LEC, besides just treating disease when they come, we try to actually go for prevention as well. And this is one of the ways we do it. And now we have the webinar, something new to us. And I hope this is something that we can carry forward even when COVID is not with us. So those of you who may have registered earlier, we actually had our inaugural webinar about a month ago, where we talked about COVID. So today I'm going to talk about another different pandemic. Now, I think the word pandemic now, if you do look up in a dictionary, everybody doesn't need to, because we already know what it means, because we've had COVID. So let me share my screen, and please feel free to ask questions at the end, and or just type your questions into the chat box here if you're in Zoom. If you're on Facebook, I have my people that are actually monitoring the questions, and you can actually answer them after this about half an hour talk. Okay, so let me share my slides. Can I just confirm everyone is hearing? Because I don't know, I got no response. I'm not sure. I'm just feel like I'm talking to myself. Everyone can hear me clearly, yes? Okay, so, all right, I'm going to assume everyone can hear me. So I'm going to talk about another pandemic. Now, I call it the silent pandemic, and it's actually childhood myopia. Now, why do I call it a pandemic? After, I'll come to that. Now, just a couple of minutes to share a little bit of information about ourselves, because we are LEC Eye Centre, and actually a daycare center for eye surgery and eye care, and we are accredited by the Ministry of Health Malaysia. And our facilities include a full set of facilities, which include our outpatient clinic. As you see here, we are seeing patients. We also have our own surgical facilities on our first floor, where we have beds and we have, chairs and comfortable armchairs for our patients, because they're here for day surgery. And this is our operating room. We have 2 operating rooms, and this is actually my colleague here, Dr. Lim, operating. We just took a little photo when he's doing that, and this is how eye surgery is done. But for another day. We're not talking about eye surgery today, but this is something that perhaps some people who haven't seen eye surgery is done with a microscope. Now, we also talk about our bread and butter service. We offer a wide range of services, but by far the most important is our cataract services. And we have many, many instruments here. I won't go into detail, but these are high technology instruments we use to deliver the best outcomes for our patients. Earlier, Anna mentioned about me being a retinal surgeon. I did my time training for providing retinal services and looking after retinal diseases for patients when I was in Western Australia. And these are a list of the things that I do treat. Retinal detachment, diabetes, age-related macular degeneration are some of the things that can actually cause blindness in the retina. Now, something a little bit more where you don't get blindness, but you actually have a lot of convenience when you talk about Lasik or laser vision correction. We have a wavelight refractive suite. If you watched the video earlier, Dr. Lim would have mentioned that we did obtain one of the, if not the first one in Asia, which still serves us very well till today, and is a very reliable platform that we're proud to have. One of the principles or concepts of how we actually practice our medicine in the Eye Centre or LEC Eye Centre is the use of cutting-edge technology to make sure that we provide the best for our patients. And we also encompass all services, which include looking after the vision care with our optometrists. We have 3 optometrists currently, and they will actually check people's eyes and check for myopia, short-sightedness, hyperopia, astigmatism, and presbyopia. And we also manage contact lenses and glasses. And subsequently, we also have our own optical shop, where if you feel that you need glasses, you can pop in and then get fitted for a pair. So already mentioned earlier, I'm medical director here at LEC. I'm a consultant ophthalmologist. That really long 4-syllable word actually means I'm just an eye doctor. I'm trained to look after eye diseases and take care of your eyes. So I'm also a retinal specialist. So what is this silent pandemic that I'm talking about? So I'm talking about childhood myopia. Now, I found that, I'm sure my colleagues will agree with me, that particularly in the most recent 5, maybe to 8 years, we see more and more children coming to our clinic at younger and younger ages that require glasses, and they're short-sighted. Now, this is actually not just a simple refractive error, because when we look more and more at how many children we are seeing, we realize that this is indeed becoming a problem. Now, what is myopia? So actually, it's something that nobody wants, but a lot of people are going to have it. Not many people know the impact of it. So people say, okay, what's the big deal? You have short-sightedness, make a pair of glasses, just wear them, right? Well, I'd like to highlight a little bit more that it may not be that simple, because there are other problems associated with it, especially now when we get more and more children getting them at a younger and younger age. So this is not an unusual picture we see. Well, obviously this is a very poorly fitting pair of glasses, but this is a joke picture, but a very cute little girl with a big pair of glasses. So myopia is my topic today, and it's actually, you can call it short-sightedness or nearsightedness. And I think in our context, most people will call it short-sighted. So just a quick highlight of how the eye works. So this is important as we start with the basics, so you know what we are talking about, because how the eye works is like a camera. Well, this is an old style camera. I know nowadays we don't carry these anymore. We have our phone, which functions as a camera as well. But essentially there's a lens. Everything gets focused into the film of the eye, which is the retina. So the whole eye is an optical system. So if you look on the right side here, when you got pupil, is like your aperture of your camera, so you can control the size of the pupil. Well, not can't control the pupil, you control the size of the aperture, which lets in the amount of light, and that's what the pupil does. And then it gets focused by the lens, and also gets focused by the cornea. All the light beam that comes in focus onto the film of the eye, which is the retina, and that's how the eye works. So this is a normal eye. So you think about this as a picture of an eye that's a cross section. That means you cut the eye in half and you look at it from the side. So this over here is an image that you will be looking at, perhaps at this building and a newspaper. And a normal eye, when you get these light rays coming in, will get focused very accurately on the film or the retina, and you get a nice clear image whether you're looking far or near. Now, if you're short-sighted, what actually happens is, if you compare this picture with the previous one, you can see that the eyeball is a little bit more egg-shaped. So in a normal eye, it's more round. In a myopic eye or short-sighted eye, it's a little bit more egg-shaped, it's a bit longer. So what happens is, all your distant images, like in this case, the buildings all seem out of focus, because the longer the eyeball, all the images come to focus in front of the film, which is not in focus. Whereas for the near objects, which is your newspaper or you're looking at your phone, that is in focus. So that's the term short-sightedness. That means you can see for short distance. So nearby you can see, but distance or far away you cannot. So that's people who are short-sighted. Hyperopia is a little bit different, or it's the opposite actually, where your distance vision is better and then your near is actually blur. So what happens in this eyeball is actually shorter or smaller than your normal eyeball, and everything cannot get focused for the near objects, whereas your distant objects are okay. And astigmatism or sangkong or silau, you call it in Malay, is something different altogether, where the eyeball shape is not affected, but your curvature or the front surface of your eye is actually not in a proper sphere or curve. That what happens, you get a lot of different focal points of images coming in. So this one will be blur distance and blur near. So it's actually one of the things that can be quite bad, because you got astigmatism, which is high enough, far and near also blur. And all these are called refractive errors, which can be corrected with glasses simply. So this is the actual report. I'm not going to go through the whole report, of course. This is something from the actual World Health Organization. I think we've heard a lot about WHO during the COVID. They talk about what kind of things they actually do. So they look at all sorts of diseases, and they found that myopia was important enough that they came out with a report. This was actually 5 years ago now, and they came together with a big vision institute and came out with this chart, which actually looking at what we call the prevalence, or how common myopia is worldwide. All right. So if you look here, they actually project numbers. So year 2000, and then they project upwards for 50 years. And you can see this red line and the numbers getting bigger. And this is an indication. This is in millions, by the way. So this is actually 1,000 million. So it's a billion. And you move upwards, and you're talking more and more people are going to get myopic. So much so that by 2050, half the population of the world will be short-sighted. Now that is not a good number, surely. So a bit closer to home, this is just a little few aspects to highlight to you, what are these numbers mean to us, or should mean to you. So this is a study done in Singapore. Singapore is just our neighbor. And what happens, it looks at the different races, whether you're Chinese, you're Indian or Malay, which is the same groups of races that we have in Malaysia, doesn't matter. Everybody has got short-sightedness, or it's actually, this is up to only 2010. So you can see if they project up to 2010, you know, the numbers are in Singapore anyway, almost 85% of Chinese are short-sighted, and these are population of Singapore. And whether it's Indian or Malay, you're still hitting at least 70%. So that's no good. And you're looking from 80s to 2000s, you can see there's a big jump in the myopia. More people have talked about it. This is in the newspaper online, talking about China having a myopic problem. And this is in Singapore, talking about East Asia epidemic levels. So this is when you start hearing the term epidemic, about myopia being referred to as an epidemic. So if you look at this, this is similarly not just in Asia, but you look at USA, Europe, you know, South America, East Asia. East Asia refers to China, and we are in Southeast Asia and this part of the world. This is the highest prevalence, but it is not low everywhere else. So you talk about 58% means that half the population is short-sighted, more than half. So this is now essentially a pandemic. So what is the difference between an epidemic and a pandemic? So you call something an epidemic when you know there's a particular disease that's affecting a large number of people in a region. So before in East Asia, like in China, in Singapore, and perhaps or in Taiwan, Hong Kong, Korea, Japan, they will call it an epidemic because it's in this region. But as I showed to you earlier in this earlier photo or image here, you can see it's no longer an epidemic. Why? Because you have it in Europe, you have it in USA, you have it in South America, and you go on to all the other continents. It's also very, very prevalent. So it is now a pandemic because it is now an epidemic disease that is spread to all corners of the world, just like what COVID has done. That's why COVID is called a pandemic. So this is a silent pandemic because it's been going on for even longer, and it's been slowly creeping up, and not enough people know about what a problem it could be, and for our eyes particularly. So why is it happening? I think this image here is very apt to show you a little small baby still in his diapers with a pair of glasses and nicely putting his hand on a laptop. So what happens now, I think we're quite familiar with the fact that our little children, probably by the age of 1 or 2, even before they're actually speaking, pre-verbal children will know how to probably turn on your phone or turn on the iPad easily rather than before they can actually speak. So is this our fault? I think partly, but a lot of time it could be these guys' faults as well. You know, Bill Gates and Steve Jobs, well, they are very famous tech moguls. And Steve Jobs here created the smartphone and the iPad and changed our lives forever. But there are articles that say that Steve Jobs wouldn't let his kids use the iPad. Now, obviously, the creator knew there was a problem with this and perhaps with the eyes, but we also know that there are certain behavioral issues that can come about with excessive digital device usage. And similarly, Bill Gates, you know, Microsoft and all that, computer and all the different technology also controls the amount of technology his children are exposed to. So we know that there are dangers associated with our digital device, and more so with relation to our eyes is about causing short-sightedness. So this is a typical picture that we see now. If you, well, going out now, perhaps it's back to normal, but before COVID, when we used to go out, well, when I used to go out more, you could see that when you go to a restaurant, you've got a family of 5, father, mother, 3 children, nobody's talking because everybody's looking at their phone, talking with each other through the phone perhaps, but this has become a typical habit, and it's a bad habit because aside from losing all our communication skills, it's also not good for your eyes. And unfortunately, there are genetics involved, means that short-sightedness can be inherited. So it's a rather complex inheritance, means there are many genes that have been found that may cause short-sightedness in families. But for sure, if you have both parents short-sighted, there is a significant chance that the children will also be short-sighted. So we know there are genes in play, at play. And then I have children that come in and then the parents are saying, oh, why is it like that? You know, I don't give them any more phone to play with. I don't give them too much iPad to look at, but they're still getting more and more increased power. I say, well, unfortunately, you know, both parents have got nice thick glasses. I think, unfortunately, it could be your fault as well. So certain groups of people, East Asians, unfortunately, are more likely to. I think that's partly genetics, partly environment, because I think, you know, the term tiger mummy comes into play because us in Asia, we are more strict with our children. We always want them to study hard and make them actually do well in school. So to some extent, we force them to actually be either having tuition or doing homework. And nowadays, when they actually decide to have a break, their break time is involved by looking at Facebook or looking at YouTube or looking at the TV or the computer. So all this involves the eyes always focusing on something near. And consequently, it also increases your chances of getting short-sightedness. So what happens now? I've told you all this information and say how bad short-sightedness is. So how do you know whether your child is short-sighted? Typically, I think you can just observe your child at home. I think when you interact with your child, you watch them at home. Are they bringing things close to their face? For example, you're reading a book with them and then you have to bring things up close to try and see clearly. Or are they walking closely to the TV to try and see clearly? Or either that they blink a lot, especially in the very young children, perhaps preschool, 5 or 6 years old. They sometimes don't know how to tell you that their vision is blurred, and then you find that they're blinking a lot. It could be a sign that they're not seeing well, so they need to be checked. Sometimes they tilt their head, sometimes they squint their eyes because they can't see and they don't know how to tell you that their vision is affected. But very commonly, when they get to school, fortunately in the school, there is some program where they do check their eyes, and get a lot of referrals coming in from the school when the teacher they get a letter, or the parents will say, the teacher says that they're not seeing the whiteboard, can't see the blackboard because they're copying their things all wrong. That's a very common way that children come in with problems with short-sightedness. So what does your child need? So you notice that now they have some eye problem, they can't see well, or they may be short-sighted. You need to bring them to see somebody who can check their eyes. So you can go to an optical shop, but make sure if you do go to an optical shop, you get your eyes tested by somebody called an optometrist. As I mentioned earlier, an optometrist, we have 3 of them with us. They are actually very important vision care specialists. They are trained and degree holders in how to actually check your child or check anybody's eyes to look for short-sightedness, astigmatism, all your different refractive errors. And aside from that, they can also look and check for other eye diseases and diagnose them and send them on to the eye specialist. So an optometrist is very important. But of course, you can also go straight to the eye specialist, the ophthalmologist. Now, when you go to these kind of places, you might see either, like over in our place, you can have a pair of this kind of glasses, and people or the optometrist will be putting lenses in front of this child or anybody that when they're testing to see if they can see clearly, because these are different power lenses so that we can check what power your child has. Or you might see this kind of almost like a space-like kind of goggles, you can see, where you can also change the lenses in these parts to actually check the power. So this process is called refraction. So those that actually, remember your science days, then you look at vision and refraction. Refraction also talks about how light is being bent when it goes through a particular surface. So similar concept, but this process of refraction is to check for your eye power. Now for children, you might come across, if you have children or you heard somebody that's taken their child to see an eye doctor, we tend to do something called cycloplegic refraction. Now, this term, all you need to remember from this is it's a process where we obtain the power of the eye. Firstly, we put some eye drops to actually relax the focusing muscles in the eye temporarily. It doesn't last forever. It just lasts sometimes a few hours, sometimes a day or two, to actually check the power accurately. Now, why do we do this? Particularly only for children, well, not only for children, but more so for children under the age of 10. We tend to do this more. Why? Because, just let me explain a little bit. The process of focusing, when we actually look at things different distance and look at things near, is this, again, a medical term called accommodation, where we actually have the muscles change the shape or the power of our lens to focus for us. So when we're looking at distance objects, the actual muscles are actually tensed up, and it changes the lens this way, and you get focus that way onto the retina. When it's actually looking at near objects, these muscles relax, and what happens is the lens becomes fatter and you get to focus for nearer objects. So this is a ciliary muscle, and it actually happens naturally. You can't control it. You just need to look distance and look near, and it actually happens automatically. So why do we need to do it? Because when you're a very young child, all of us will be like that. We have 17 diopters. Diopters is a way of measuring your power and the amount of focusing effort that you have. So 17 is the number that you have when you're young. But as you get older, when you reach 10, you lose that ability to focus so much. This is just a natural loss of the strength of this muscle. And when you get to 25, it becomes 10. And when you get to 40, it becomes 6. Now, 40 is the not magic age, but it's usually the age where people get what we call reading problem, or Cantonese call it 老花, 老花, or you're just having difficulty reading because your focusing muscle has become so weak that it's only left with 6 diopters of power when you started with 17 when you were young. And when you get to 50, forget it, it's 2 diopters, you definitely need reading glasses. So this is a natural process. So why do we do this? Because as we get older, we lose it. And when you're very young, this focusing muscle is so strong. And in some cases, it actually gives you an artificial impression of how well they see, because they're focusing so hard to look at objects that they actually can see when their actual eye cannot actually hold that muscle focus or muscle strength for so long. So you need to put the eye drops in to relax the muscle, then you get the accurate power. So this happens when we put the drops and you actually relax the muscles. It takes about 45 minutes if fast, sometimes up to 90 minutes to relax these muscles. And then we do the power testing and get the correct power to give to the patient. And the relaxing muscle also causes a dilation of the pupil. The pupil gets bigger, so we can check the rest of the eye to look for any other eye problems as well. So 2 functions by doing this. And this can only be done by an eye doctor because this drug has to be prescribed by us for you to put into the eye. And you can't get it at an optical shop. So if you do have a young child, first time wearing glasses, you should see an eye doctor to get a proper test first. Subsequently, when you get a good power, and then you don't need to repeat this every time we actually see the child, because we already know in some cases, whether you put drops or not, it doesn't matter because their muscles are not focusing so much. So we know that which children will actually be more likely to require the drops more often when we test. So what is the problem? The problem with myopia, why do I say that it's a problem? It's not a simple thing of just wearing glasses and then be okay. Because when the power goes up, usually beyond 500 or 600 degrees, then you can cause serious sight-threatening problems. That means you can go blind from some of these diseases that can affect the eye. So this long-term here actually relates to some sort of degeneration of the retina. And if you've heard of macular degeneration, this is a form of it that you can get when you get older, when you have very high powers. You can also have a higher risk of developing glaucoma. I think glaucoma, everybody knows that it can cause blindness and it's irreversible. You can't actually get back your vision if you have glaucoma and you lose your vision from that. You can get retinal detachment, you can get cataract, and all these are things that are more likely in people who have very high short-sighted eyes. So what happens now is we get children who are very short-sighted at perhaps age 5, they come in, they are 300 degrees or 200. So they've got a whole lifetime ahead of them, and the chances of them hitting 500 or 600 and beyond becomes way higher, because when you start school, then you get all the homework and coming, and then when you go for different parts of your academic career, you take exams, you study harder, you spend more time on digital device. So the chances of them hitting this high level becomes much more. And that's why it's a problem, because when they get older, usually maybe when they're in their 40s, 50s or more, then they will have eye problems. Now, for those children that I see now, when they're 40 or 50, I won't be in practice anymore, but somebody else will have to look after their eyes when they develop these problems. So it's important that they are aware, and as parents, we are aware that what problems they can have and try to minimize the risk. So that's why I think it's important that this information is shared to as many people as possible. So now, your child is short-sighted, what does that mean? Don't be so worried to think that, oh, my child is short-sighted, that means they are going to be destined for blindness. Of course not. Don't worry about that. That means that they are need to wear glasses, and if you can look after themselves, well, they lead a normal life, of course. But they have to be aware that if they get any of the conditions that I mentioned earlier, the earlier that you get treatment, it is still possible to actually control and lead a normal life. Doesn't mean that you go blind, definitely. But if you're not aware and you get one of these things and you don't know about it, then that's where the risk comes in. So when the child is myopic, first thing I say is just wear glasses. Glasses don't actually make the power go higher. I have a lot of parents that come in and say, if they have short-sightedness, give them glasses. The more they wear, the higher the power goes. So I must let them wear some of the time. I don't make them wear all the time because it's dangerous. I think that is untrue. because what happens there is dangerous, because you don't give them glasses, what happens is they're not seeing well. So if they're not seeing well, it will affect their overall development in terms of how important your vision is. If you don't see well, your eyes don't develop normally, your vision is not normal. Your school can be affected because you're not seeing well. So a lot of things can come downstream of that. So glasses are important because it helps your children see, but it does not make the power go up. What makes the power go up is your digital devices, the time spent reading books or storybooks or in front of a computer, TV, and all that. So I always tell my parents that actually have children that are short-sighted to try and cut down the amount of near work activities they have, or rather not let them spend too many hours at one shot going from tuition to homework and then relax and go and read the book and then go and play on the computer. Those are things that your eyes don't get to rest. Encourage more outdoor activities. And now it's difficult because of COVID, but outdoor activities are important because there are studies to show that going outdoors will help to reduce the risk. Now there are eye drops now, and I want to talk a bit more about eye drops because it's something that we can actually do. And I think as parents, we feel that it is important because now we can do something for our children. Aside from just telling them not to do this, not to do that, we can actually use eye drops and help to control. There are contact lenses as well. I'll go into a little bit more detail. Now, this is just a snapshot of a study that was actually done and republished into the literature for the doctors to read. They looked at 16 different ways to control short-sightedness in children. Now, I won't go through the whole study, of course, because this is a very scientific thing, but just to highlight some of the things it says here, the most effective way to control short-sightedness from this big study is to actually use the eye drops, pharmacologic treatment, which is eye drops. And there are certain specially designed contact lenses called Ortho-K. I will tell them a bit more about that, which has moderate effects. And there are also spectacle lenses that can be used, but they only have minimal effect. So you might hear people that have actually got different ways that they say they make glasses specially, and then they can actually control the short-sightedness. They do work, but the most common and the most effective way is these eye drops that I'm talking about. So before I go on to the eye drops, let's talk about your glasses. As I mentioned just now, do you wear them all the time? Yes. If you're short-sighted, you wear your glasses all the time. And do you give the full power? I have parents that say that, oh, my child needs 300 degrees, but the optical shops say they only prescribe 200 degrees. Why? Because you give full power, you can actually cause the short-sightedness to go up even more. Now that's some way, yes, there is one strategy that purposely undercorrect or give you a lower power to try and minimize the increase. But as I mentioned, it has not been proven to be the most effective way of controlling short-sightedness. It is the eye drops. So I always give the full power because they need the full power to see clearly. And children need to go to school. If you don't see clearly, their studies will suffer. Don't worry too much about the type of lens. There are certain myopia control lenses which may be useful, but they are quite expensive. And the type of frame, I think, has to be something that is very hardy, because if children are rough with their glasses, if you don't look after them well, they will break glasses non-stop, and it'd be difficult and expensive to replace them all the time. So go for correct power. Go to any optical shop, be it ours or anywhere else, to make sure they fit well. So no point having a pair of glasses that's so big they slide down the child's nose because they've got a flat nose bridge and they're looking over the glasses. The glasses are not working. They might be wearing them all the time, but not using them well. So have some sort of coating, anti-scratch coating, things like that, and make sure they're durable. Myopia control lenses I mentioned just now, and these lenses actually are designed specially just to change the focusing a little bit so that it does not stimulate the eyeball to grow so much and your power doesn't go up so high. But again, it is one of those ways that you can control short-sightedness, but not as good as the eye drops. So just now I mentioned contact lenses. There are special contact lenses that have been made called Ortho-K lenses, which are actually hard lenses. They actually change the shape of your eye. It's not the soft ones. You put it onto the surface of the eye, and it purposely changes the shape of the eye so that you can actually focus clearly without glasses or the contact lens. But this way, this contact lens only works by wearing it to sleep. So children wear this lens to sleep. So when they wake up in the day, they take it out and they go to school or anything, and they can see well without their glasses because their short-sightedness is corrected by the change in the shape. But these lenses are very expensive. They need to be specially made. There are people that make it. We actually don't offer it because I'm not so confident that the children are able to look after their contact lenses well. And you need very committed parents to make sure that they can put the contact lens in for the child, make sure the contact lens is clean, and you're going to make sure that they don't swim in the lens and they don't, shower with the lenses on. And sleeping with the lens can be a problem because when you sleep with the lens, sometimes not enough oxygen gets to the eye. You can get infections as well. So I don't really like to use contact lenses for short-sightedness. These are some of the complications you can get. You can get little scratches in the eye. You can get allergic reaction from wearing too much lenses for too many hours. And you can get an infection. And you get an infection like that, it can be quite dangerous because it causes a scar right in the center. And it can affect your vision permanently. So this is the eye drop I'm talking about. So atropine is something that has been used for many, many years. It's been proven before that it works. And the dose has always been an issue because the higher dose has some side effects of causing the pupil to dilate. And that actually makes it very glaring for the child and it's not comfortable. So this is a study that came out from Singapore. And this is actually quite a few years ago now, 2015. And they used this atropine at this dose, 0.01%, so very, very low dose. And they found that over 5 years, these drops were effective in slowing the progression of short-sightedness and less side effects compared with the higher dose. So the higher dose, 1%, is the normal standard dose, which may be more effective, but a lot more side effects. So now they came to a balance to find that very little side effects with 0.01%, 100 times less the strength, but you still get a good control of the short-sightedness. And this is a flyer. If you come to our center, this is a flyer that we have. We can actually give you more information. It just gives a little summary of the drops and the myopia control program that we have here at the LEC Eye Centre. I think earlier on in the video also, my colleague Dr. Umi also talked about this a little bit, saying that how we have this control program where we start off in suitable children, where we start off with this eye drop. It's only used once a day, and usually I recommend it before they sleep. So before they sleep, brush their teeth and everything, wash their face. Then at the bedside, before you either read them a good night story or something like that, you take an eye drop, put one in each eye, and then you go to bed. Do that every day. And over a period of time, they need to be used for a minimum of years. You can't just use it for a few months and you finish. You got to use it for at least 2 years. And a lot of my little children that have short-sightedness that come to my clinic are on these drops for many years. They can start maybe if they're 5 or 6, they can go on till they're 10, 12, 16 years old sometimes because they seem to be effective. So myopia control program, we find that if these eye drops are working well, they continue for a period, usually go beyond puberty and even up to 16 years old, as I say. And if they're not effective enough, we combine that with making those myopia control lenses as well. So a combined strategy, which is not often used, can also be useful. But this is part of the program that we have at our center. So this is, as I mentioned already, we need to regularly monitor the power. So normally once you start the eye drops, you will see in a few months to make sure there's no allergic reaction, but it's very rare to have allergic reaction to this. Then make sure that it's working, and we have to follow up for at least 2 years to see that. And normally when everything is stabilized, we'll see every quarter to every 6 months to check the power and see whether it's going up. We don't see you every month. It's not necessary to do that because your power won't change that quickly anyway. But this is how the drops are used. Myopin is actually made by that Singapore group. They come up with this study, and that's how we actually got hold of this to actually share to our patients as well. So this is an atropine eye drop, and atropine, as I say, is a very, very old drug that's been found actually from, is a berry. So it's called atropine because it comes from this berry called Atropa belladonna. And old days, people used to use this, the women, because they used to cause dilation of the pupil, and it actually makes them a little bit more sexy, I suppose, during those days in the 14th to 17th century. But they discovered the usage for this purpose much later on, of course. Now, the other question I used to get a lot of, or I still do, is a lot of parents. In fact, today when I saw a child who's actually 4 years old and she's 600 degrees, okay, the mom will ask me, how, when my child gets older, can she have LASIK? I said, yeah, of course, if she's suitable, she can have LASIK. But LASIK is not a cure, in the sense that, yes, it allows people to actually not having to wear glasses or contact lenses to see clearly. But no, it's not a cure, because if your eyeball is so long and it's actually more than 600, it still is at risk of all those diseases I mentioned before. So having LASIK doesn't change that. It just means that you don't need glasses, but you still need follow up for the rest of your life to make sure you don't have any of those diseases. And I try to make sure that parents understand that LASIK is possible, but usually until the power is stable. I don't do LASIK in people under 18 most of the time. In fact, most of the time they have to be 21 or older because that's when the power is stable. Otherwise, if you're actually doing it at a time when the power is not stable, then what happens is when the power increases, everything goes blur again. So there's no point doing LASIK as surgery if it's not going to be effective long term. So coming to the last slide now almost, the take-home message really is to highlight to you that myopia is indeed a pandemic like the COVID, but myopia, I can tell you, is going to be with us for a long, long time, even when COVID is gone, because it's been around already for a long time and it's getting worse, and there's no real good way of us controlling it. And the eye drops has been in use for the last 5 years, and people are still looking for better ways. Why? Because we deal with a lot of the problems of high myopia now, and we know that it can be blinding. So we need to control the time as parents. We need to control the time that our children spend with the devices to ensure that they do not develop short-sightedness, or if they do, does not go up so high that they become at risk of problems when they're older. Be aware of things that can be used to control myopia. All those things that I mentioned about controlling device time, more outdoor activities, at least using the eye drops, and making sure that your child, as they get older and more mature, they understand that they need to actually have lifelong follow-up to ensure that they don't develop any of these eye diseases in future. Or if they do, they seek help early so it can be controlled and they don't go blind from it. All right. So the things that actually I want to just highlight a few things. If you're interested to come and see us for any reason, maybe for your children or for anything at all, you can actually make an appointment to see us. I think those of you on Facebook, you can actually message us there. We have an Instagram, we have the YouTube channel, our website, call us, leave us a message, email us, many, many ways to get to us. Another way is we also have a use of an app. This is an appointment app that we have used, and this thing can be downloaded either on the Google Play Store or even the App Store. It's called Accommodation. You just search for our center, you'll see over here, just highlighted a page where it's my name there. If you'd like to make an appointment, you click over here, and what happens then, you can see and choose the date at which you want to come in to see us, and look at the available slots and just put your name in, put your contacts, and then your contact details, and then you will get an SMS to confirm your appointment, and we'll see you when you come in on the day. Of course, if you actually have problems, right now, I think most people are almost going back to normal. You actually do delivery of actually eye drops or any drugs that you require, especially this is mainly for our patients that have already been with us for a while. And we also do online consultations. I think this is one way of doing it. We have a webinar. We also have patients that call in and say, oh, they can't come in, but they just want to ask a few questions. So we arrange to do a WhatsApp video call and to actually see face-to-face and talk to our patients so that they can actually be reassured. So these are some of the ways. I thank you all for your time. I've taken about half an hour or a little bit more to tell you about this pandemic that I'll refer to as myopia. And any questions, I think hopefully there will be some discussion or questions coming from either our Zoom guests or from Facebook or YouTube. So thank you very much. And I shall stop sharing my screen and we can answer questions.
Thank you, Dr. Lee.
Okay.
We do have some questions from our Facebook fans.
Okay.
All right.
We start with our Zoom people because we can see their faces. When they ask a question, we make them turn on their video.
Right. So those who want to ask question directly with Dr. Lee from the Zoom attendees, you can unmute yourself and ask the questions.
No, everyone's shy.
Okay, I will address some questions actually from our Facebook, Facebook fans. One is from Zen Lo. She asks, can myopia actually be reduced for a 6-year-old kids?
Unfortunately, as you can see, what I was mentioning all the while during my talk is how to control myopia. Unfortunately, we can't reduce myopia. So there's no way of doing that yet. The only way you can so-called theoretically reduce, of course, LASIK does that. I mean, it reduces your power to close to zero, but that doesn't actually change it unless you do LASIK, which is a surgical procedure. So not for children of 6 years old, we can't reduce. We can only control, unfortunately. Yes.
Okay, the next one would be from Jean Lee. Dr. Lee, can I use this eye drop to prevent my child from myopia?
Okay, that's a good question because prevention, of course, people will say is better than cure. Unfortunately, if your child has got no myopia at all, and there is perhaps little indication or risk that there is myopia, then it might be a little bit too much preemption to actually start something when you don't have it. So it's like saying, I'm going to take a Panadol before I get a headache so that I don't get a headache. So it's a bit difficult to say that. I think I would more likely, if there has a little bit of myopia, let's say, for example, I've got a nice family where, you know, every 6 months I have the wife and the husband come in, you know, they got nice thick glasses, both husband and wife, and they have got 3 children, and they're very lovely children. I've been seeing them for the last 6-7 years. When they were 5-6 years, now they're teenagers, and they got 2 girls and a boy, and they're all beyond 600 degrees. But when they started out, they're already around 500. So in that kind of family, I would start myopia right at the beginning. You know, so when they have their family history is strong, you know, siblings have it, parents have it, I said, don't wait, just start. And it managed to control over the last 5-6 years. At least they don't progress so quickly to reach that 1,000 mark when you start so young. So more likely is when I have scenario when the younger kids come in, they have 100, 200 degrees, just a single child has myopia. Then I will follow up for a little while, maybe 6 months or a year, and you see if the power shoots up very quickly, then I would start myopia. But having had a conversation with the parents first, if they say, I don't want to wait for my child to have the power go up before I start, can I start straight away? I say, yeah, it's fair enough to do that. They are aware that you need to put the drops regularly, and you don't expect the power to drop, but you expect the power to maintain, and then we can start it right at the beginning. But I've not quite started as a prevention of myopia yet.
Okay, actually, Jane Lee got a continuation question. Can the eye drop actually control for astigmatism?
Actually, not proven to. I think the actual study itself talks about myopia, and myopia is by far, in our population anyway, and the most common of all the refractive errors. The refractive errors will be short-sightedness, far-sightedness, astigmatism. All these are refractive errors, and the most common is myopia, and therefore all the strategies are to try and control this. So astigmatism, no, the eye drops don't control astigmatism, but it can actually only try to control myopia, short-sightedness.
Okay, the next question will be from Chris Hill. How long time can a child spend on a device per day recommended?
Well, that's a very good question. I don't think there's been a study, or maybe there has, but I've not actually been aware of a good study that has shown there is a cut-off time. Now, I think if you talk about common sense and logic, what I tend to tell my patient's parents is that every one hour, maybe max 2 hours, you need to stop, take a break, do something else, as in not move from the phone to the TV, then to the computer and back to the phone. That's not taking a break. So when I say take a break, maybe go and do some exercise or just do some housework, you know, give them a chore or wash the dishes or do something else rather than looking at the phone. And I think it's easier said than done. Nowadays, we are busy parents, both either busy, the father's busy working, mother's busy working, or busy doing a lot of things to prepare the house and everything. So the device becomes a babysitter, which is actually a bad habit, but I think we all do it, and we have to be mindful that we try not to do it so much. So there is no good cutoff as to what is the maximum number of hours per day. But if you ask me personally, I think if you have staggered amounts over the day, I think maximum, 3-4 hours, 5 hours, probably that's quite a lot. You talk about a daily usage. And that's why when we were under lockdown, you know, there was a big issue because children need to go online for their lessons. And then when they're not online, they're actually doing their usual, you know, time spent on the digital device anyway. So when the lockdown sort of got eased and then patients were able to come out, then we started to see more in our clinic as well, patients with more and more problems related to excessive device usage. Not just children will have their short-sightedness suddenly shoot up. You also have adults getting with eye strain. Even some of them, their power also went up even as adults. So this is all related to excessive device usage. That's also partly why the webinar will be cut off by 2 hours. We can't go too long.
So best to detach yourself from your devices and move. Right. Actually, I think it's good, right? So you can actually move your body and you won't have like stiff leg, stiff fingers as well.
Okay.
All right. The next one will be Kang Wei. Just now, Miss Kang Wei's question. Are the eye drops available in the pharmacy?
Not at the moment that I'm aware of. These eye drops are only prescribed by doctors now. So I know some colleagues, well, a lot of our colleagues in Malaysia use them, and they don't actually have them available in the pharmacy, if I'm not mistaken, because it needs the doctor to actually follow up. You can't just buy them and use them without actually knowing whether it's got any effect.
Actually, I'm curious, what about our Zoom attendees? Do they have any questions? They seem to be very quiet, either too shy or all the question has been asked from the Facebook fans already, so they don't have to ask much question. So I'm just wondering, any questions from our Zoom attendees? If yes, you can unmute yourself to ask the question, because it's not just only asking related to children short-sightedness problem. You can ask any question related to eye diseases, eye care. Fans already.
Yeah, any eye problems that you want to talk about, you know, for the next maybe 8 to 10 minutes, or if not, then we could actually, you know, not keep.
We have a few more questions from Facebook.
Okay.
We still have a few more questions, so I was just
okay.
Yeah. So I guess it seems like the Zoom attendees are pretty quiet, you see. So I'm not sure whether they have actually asked a question I mean, the question all being asked from the Facebook. Okay. The next question will be from Jonathan. Jonathan asking, is LASIK a permanent solution?
Oh no, I think I covered that. Permanent solution for myopia, in what way? I think it is a solution to improve your convenience where you don't need glasses or contact lens. In actual fact, our next webinar, I think Dr. Lim, my colleague Dr. Lim at our LEC will also be talking a bit more about LASIK at our next webinar. So keep your eyes peeled on this Facebook page, or we will get you out some more information about LASIK and how we actually do it at our center. But LASIK is not a permanent solution in the sense it doesn't cure myopia. It just gets rid of your glasses and your contact lens. And when you do hit the age, when you do develop cataract, or when you have other eye problems, then your vision can also get affected. So it is impermanent, I would say.
Okay, so for those reminders again, remember to like our Facebook and subscribe our YouTube channel, so you get all these updates from our upcoming webinars. Okay, we have one question from Yvonne Yi from our Zoom attendees.
Hey, hello.
Normally, the question is normally how old we have cataract and the cause of having cataract.
The most common cause for cataract is age. So when you ask how old, I think actually what is a cataract? A cataract is actually our lens, our natural lens inside the eye that actually gets old. So it is actually not a growth. It doesn't grow in the eye. It just basically gets dirty as we age because we're not able to clean it. So normally when you hit 50, 55, there will be a little bit of cataract coming in. Very minimal to the extent where it may not even affect your vision. It might change your power, or it might just make you feel that how come my vision is not so good when I'm looking when I'm reading in a dimmer environment. So that is the earliest sign of cataract usually. But when it becomes significant, it can be quite variable. But on an average, 60 plus towards 70 is the time of age where most likely you have significant cataracts, and that's my patient population usually. So cataract will come with age. That's the most likely cause. Sometimes other things can be, if you have an injury to your eye before, I just had a patient last week where he had a badminton injury. You know, when you play badminton, you get hit by a shuttlecock. It's not that uncommon an injury that I see. You may not develop problems immediately, but one of the things it can do, it can cause your cataract to come maybe 20 years down the line. He had his injury when he was in his 30s. Now he's in his 60s and he's got a cataract which is more on the injured eye compared to the other side. The other side actually got a little bit, but the other one that got injured will get more. So injury can do that. Certain drugs that you take, like steroids, if you take it either for treatment of other conditions, you can cause cataract as well. And but the most common is still age.
Okay, so we have next question by Li Chen. Li Chen is asking, is watching movies or playing games on projector screen better than watching TV or using devices to play games? Is it said that the projector reflect lights, so might be better? Is this true?
Good question. Because you don't have the actual screen, isn't it? Yeah. Well, I think if you think about what the actual screen does, I think there is reflection, and they call it blue light that comes from the screen when you actually have the pixels that actually give you your images. So to some extent, yes, I think logically you might think that a projector may be better, but I don't think, a lot of the time when, us as doctors, before we can actually say something to recommend or to say that it definitely works, there has to be some evidence, and evidence comes from people who have done studies to prove that. And again, I don't think it's proven, but logically it may be better than a screen because you're getting just the image projected onto a projector. But how many of us got a projector, right? And you need a space to have a projector, surely. So most of us will still use a screen.
Okay, the next question is from Jermin Xiao. Jermin Xiao asking, age recommendation to correct myopia in children via Lasik or Lasik. Any criteria?
Okay, for children, like I said, we don't normally, or I don't recommend any correction before the age of 18 because you will not have any stable powers. However, there's very, very rare cases where people might do it, but definitely not in our center and not something that I would recommend because it's not stable. If your power is not stable and you're not able to know what is the end point, then you're only treating it temporarily and you're putting a child or a young person through an operation. And the other actual difficulty would be cooperation from the child. A lot of the time, yes, you can argue or put the child to sleep to do LASIK, but having said that, when you do that, then there is an additional risk of having to, put the child into a GA to actually do things when it's not something that is life-threatening or definitely sight-threatening. If you have short-sightedness, yes, it could be sight-threatening later on in life, but you don't want to do any procedure at the early stage when, firstly, I don't think the benefit is proven to be lasting because this power is not stable and you're putting a child through an operation, which I think may not be necessary at that stage.
Okay. Zenlo is asking, I want to order Myopin eye drop. So can she just come into LEC Eye Centre? Does she need to bring her kid to see the doctor first before getting the eye drop?
Unfortunately, I think because Myopin is actually something which is very specific and not to be universally used without first seeing us, I think I would advise to actually check your child first to see whether it's suitable in the sense that it requires it before we start Myopin. I'm not so happy to just, give eye drops out or just to sell eye drops to people and just say, yeah, bye, and then, and not know what's going to happen. So I think we need to see the child first to make sure that the child does need Myopin before we actually prescribe it. And for all of my parents that come in with their children that already are on Myopin because we've been giving them for many years, then of course, please just come and take it. And we can even deliver it out during the MCO to some of the parents that couldn't come out. But if you are new to us and have not seen your child before, we need to see your child first.
All right. That's all the questions from the Eye Centre. Facebook. There's no more question from the Facebook chats. So I would like to thank Dr. Lee and all the attendees from our Zoom, as well from our Facebook. I would like to thank Jean Lee, Jermaine, Pern, Peter Ong, Cynthia Yu for sharing our webinars. Wai Teng, Mrs. Yang, Sherman, Fam, thank you for all sharing. Jonathan, thank you for joining us for this webinar. Remember to like and subscribe our YouTube and Facebook page so that you keep yourself posted for our next upcoming exciting webinar about eye healthcare. All right, so thank you, Dr. Lee, again.
Thank you,
everyone.
Thank you, everybody. All right, see you all again soon. The next time will be Dr. Lim talking about LASIK, as I mentioned. So look out on our Facebook page. We'll give more information out soon. Thank you. Good night.
Okay, so our next session for LASIK by Dr. Lim will be on the 21st of September at 8:30. So keep yourself updated again, all right? So if you want to have an up-close and personal session with Dr. Lee, so just remember to pre-register, then you can join our Zoom session and you can actually ask questions directly with Dr. Lee. All right, so good night, everyone. Thank you for joining us. So hope to see you again. Good night.